In our daily lives, very few people would consider snoring a disease. It's so common that a deadly type of snoring can sneak in and we'd be completely unaware. In April of 2025, a driver fell asleep at the wheel and at a speed of nearly 100 kilometers per hour, rear-ended a semi-truck. This resulted in a horrific tragedy with 7 deaths and 1 injury. An investigation revealed that the main cause of the accident was that the driver suffered from severe obstructive sleep apnea syndrome, which we commonly refer to as severe snoring. In mild cases, this condition causes patients to suffer from headaches, impotence and daytime drowsiness, lack of concentration, and can affect their relationship with their bed partners. In severe cases, it increases the risk of high blood pressure, diabetes, coronary heart disease, heart failure, and cognitive dysfunction, among other diseases. The mortality rate for patients with untreated severe OSAS is 3.8 times higher than that of the general population. You could call it killer snoring. According to a report published in a respiratory medicine journal in 2019, among the population aged 30 to 69 in China, approximately 176 million people have obstructive sleep apnea. And early detection, diagnosis, and treatment are crucial for improving sleep apnea and reducing the risk of other related diseases. So in this video, we'll explore its symptoms and dangers, methods for diagnosis, and treatment options as we unmask this silent killer of sleep together. There were 4 of us in my college dorm room, and 3 of them snored. What was even crazier was as soon as one of these sleeping giants started to roar, the other 2 would immediately transform and follow suit. The entire dorm room would instantly erupt into a kind of ensemble performance, like a marching band that just kept getting louder and louder. During that time, I was a nervous wreck, and I was desperate to figure it all out. So why on earth do we snore after we fall asleep? The soft tissues in our upper airway start to relax, which narrows our airway a bit. Now, if you add another factor on top of that, or several factors that make the airway even narrower, then the resistance as air flows through increases. This causes the airflow to vibrate the surrounding soft tissues, which creates a sound. And that's what we call snoring. Lots of things can cause the airway to narrow, like swelling in your nose and throat from allergies, swollen tonsils from an infection, or excess soft tissue in the neck of someone who's overweight pressing on the airway, and even throat muscles relaxing too much after drinking alcohol and so on. The narrower the airway, the stronger the airflow and potentially the louder the sound. So what happens if the airway gets nearly or completely blocked? Well, it might sound something like this. This is the infamous severe obstructive sleep apnea. This kind of snoring isn't just loud enough to wake the dead. It also has a charming habit of just stopping. After 10 seconds or even a minute or 2, the person will suddenly let out a massive, desperate snore. That's because the person's breathing actually stops when their airway gets blocked. This can happen more than 35 times an hour. So what big deal, right? First off, it ruins relationships. You will never know the person who lies awake night after agonizing night because of your snoring, just what kind of fury and desperation they're bottling up inside. Secondly, due to repeated episodes of nighttime, intermittent oxygen deprivation, and disrupted sleep patterns, patients can experience mild symptoms like headaches and drowsiness, trouble concentrating, and even sexual dysfunction. In severe cases, it can lead to high blood pressure, coronary heart disease, diabetes, and stroke. In extreme cases, it can even lead to sudden death during the night. Talk about a killer snore. As terrifying as this kind of snoring is, sometimes not snoring at all isn't necessarily safe either. For instance, due to brain injuries, nervous system diseases, and so on, and central sleep apnea, which is caused by lesions or other issues. This is when both the airflow from your nose and mouth and the breathing movements of your chest and abdomen stop at the same time while you're asleep. In plain English, your brain just intermittently forgets to breathe, and some patients have a mix of both obstructive and central sleep apnea. So how can you tell if you might have this problem? Here's a simple checklist. Give yourself 1 point for each item that applies to you. Go ahead and add up your score. If you scored 3 or more, it suggests you're at risk for OSAS. In that case, it's highly recommended that you go to a hospital to get tested. Clinically, the main way to diagnose this is with a sleep study, also known as polysomnography. Basically, this just means you'll need to spend 1 night in a sleep lab at the hospital. This allows doctors to monitor various physiological parameters of your body. This includes your airflow, chest movements, brain waves, heart rhythm, blood oxygen levels, and so on. The most important metric is the apnea-hypopnea index, or AHI. This is the number of times you stop breathing or have shallow breathing per hour. An AHI of 5 or more times per hour, along with any of the following clinical symptoms, or an AHI of 15 or more times per hour without any of those symptoms, can both result in a diagnosis of adult obstructive sleep apnea. A sleep study doesn't just provide a diagnosis, It can also assess the severity of the patient's condition. It provides a full assessment of your sleep structure, oxygen levels, and changes in your heart rhythm and blood oxygen. The only downsides are that it's a bit pricey and you do have to spend a night in the hospital, if that sounds inconvenient. Or if your local hospital doesn't have the facilities to conduct a PSG or sleep study, your doctor might have you use a portable diagnostic device for an initial screening at home, blood oxygen levels, and so on. The key metric here is the apnea-hypopnea index, which is the number of times you stop breathing or have shallow breathing per hour. An AHI of 5 or more times per hour, along with any of the following clinical symptoms, or an AHI of 15 or more per hour, without those symptoms, can both lead to a diagnosis of adult obstructive sleep apnea. A sleep study doesn't just provide a diagnosis, it also helps assess the severity of the condition, including your sleep patterns, oxygen levels, and provides a full assessment of changes to your heart rhythm and blood oxygen. The downside is that it's a bit pricey and you have to be in a hospital for a night. If that sounds inconvenient, or if your local hospital isn't equipped to do a PSG, which is the sleep study, your doctor might have you use a portable diagnostic device for an initial screening. Model, it can record and analyze multiple physiological data points at the same time, and you can take it home with you. The downside is that it's not as comprehensive as a PSG. If you really don't have time to see a doctor, at the very least please use a smart band or a smartwatch to monitor your blood oxygen levels. Normally a healthy blood oxygen level is between 95% and 100%. If it's consistently below 90%, please go to the hospital. So if you're diagnosed with OSAS, how can we manage and treat it? First, control the risk factors. The main risk factors for OSAS include genetics, sex, age, obesity, smoking, alcohol, and structural abnormalities of the upper airway, among others. Among these, genetics, sex, and age can't be changed in principle. So let's focus on the ones you can control. 1. Control your weight. Obesity is closely related to the occurrence of OSAS. Losing weight reduces the fat deposits in your neck, which can lessen the collapse of the upper airway and thus improve airway narrowing. 2. Change your sleeping position. When you sleep on your back, gravity causes the base of your tongue to fall back and your throat to collapse. Elevating the head of your bed and sleeping on your side can reduce the problem of upper airway obstruction. 3. Quit smoking and drinking. The components in alcohol cause the muscles in your airway and throat to become overly relaxed, which worsens the airway collapse. 4. Treat the underlying cause. Actively correct any underlying medical conditions that cause or worsen OSAS, like hypothyroidism, for example. If none of the methods above have a significant effect, you may need to consider non-invasive positive airway pressure therapy. This is also the first-line treatment for patients with moderate to severe OSAS. The principle is that a ventilator provides a stable stream of pressurized air, which keeps the upper airway open, which ensures oxygen is delivered properly and improves the patient's low oxygen levels. For sleep therapy, you need to see a doctor before using one. They'll need to confirm you don't have any contraindications like a collapsed lung and perform a pressure titration study to set the specific pressure that's best for your at-home treatment. So how do you choose the right breathing machine? First up, effectiveness. You see, during the different stages of a patient's sleep, the required pressure isn't always the same. The breathing problems that happen during sleep can be roughly categorized as airflow limitation, snoring, hypopnea, and apnea, to name a few. Depending on the underlying cause, these can also be classified as either obstructive or central. A top-notch breathing machine needs to accurately identify all of these breathing issues, and based on that identification, it needs to have a smart strategy for automatically adjusting the pressure up or down. For example, with an obstructive event, the pressure needs to increase promptly to open the airway. But for a central event, the airway is already open, so the machine should avoid increasing the pressure. Furthermore, the airflow output needs to stay in sync with the patient's own breathing rhythm. If the machine responds too slowly, or the pressure suddenly spikes, or if the airflow is unstable, it can negatively impact the effectiveness of the therapy and even make you more uncomfortable. A good at-home breathing machine will use smarter algorithms to improve the synchronization between you and the machine, making it less uncomfortable when you first start using it. Next up, comfort. As great as these machines are, they can have side effects. For instance, the constant airflow can cause more moisture to evaporate, drying out the mucous membranes in your respiratory tract. This can lead to a dry mouth, nosebleeds, or a sore throat. That's why many breathing machines heat and humidify the air they deliver, providing a much more comfortable experience. But be careful. If the temperature and humidity aren't controlled properly, like if there's too much humidification, condensation can build up inside the tube. Moisture can actually affect the user experience, and the ventilator's mass can also impact how it feels to use. If it's too tight, it will press on your face. If it's too loose, it might leak air. so it's best to choose an adjustable one. You can choose a nasal mask based on your own needs, or a full-face mask that covers both your mouth and nose. Finally, there's the noise. This noise doesn't just refer to the sound the machine makes when it's running, but also during actual use, the dynamic noise created by the airflow fluctuating with your breathing. If a ventilator is too loud, even if it's effective, you're just trading one sleep problem for another. It won't just affect the patient themselves, but also their bed partner. Only by properly addressing the issues above can patients stick with the treatment and receive long-term benefits. Here I'd like to recommend the RESMI 5 series ventilator. Its version 3.5 intelligent breathing algorithm can accurately identify the various types of respiratory events that most commonly occur while the user is sleeping and automatically adjust the pressure. It provides a targeted output of the airflow volume that is better suited for the current situation. It has an especially high recognition accuracy for the more unique condition of central sleep apnea. If central abnormalities occur frequently, or other breathing irregularities, the i5 ventilator will sync these issues into the next day's report, making it convenient for you to review and understand. At the same time, it will also upload this data to the cloud. While ensuring the security of user data, professionals can conduct remote assessments to see if any adjustments are needed, either to the parameter settings or if timely intervention is required. And in terms of comfort, the i5 uses triple sensors to perceive in real time the air inside the ventilator and the changes in temperature and humidity in your sleep environment. And through an adaptive algorithm, it adjusts the temperature and humidity accordingly, so that no matter where you are or what season it is, you can always breathe warm, comfortable, humidified air. The airflow it provides isn't just super stable. It also responds instantly to your inhales and exhales. You can even choose different pressure modes based on your personal needs. Whether you want a gentle ramp up or full pressure right away, it's just one button press. And when it comes to noise control, the sound the machine makes when it's running is only 27 decibels. That's about as loud as an air conditioner or the soft rustle of turning a page in a book. Plus, it's simple to operate and easy to carry. It's incredibly friendly for older adults. Not only can their kids check on their parents' treatment remotely, but healthcare providers can also guide users from afar, adjusting the settings to help newbies get through the adjustment period. Besides non-invasive positive airway pressure therapy, treatments can also include oral appliances and surgery. The principle behind an oral appliance is that by moving the lower jaw forward, it brings the base of the tongue and the hyoid bone forward, creating more space for the airway. This is a viable option for those who can't tolerate non-invasive positive pressure ventilation, can't have surgery, or for whom surgery was not effective. Surgery, on the other hand, can correct narrowings in the patient's nose and throat. Unfortunately, its application is quite limited. It's only suitable for patients with anatomical abnormalities in the upper airway, like an enlarged uvula or enlarged tonsils. And after all, it is an invasive procedure, so it comes with certain surgical risks. For any of the treatments we've mentioned, you need to have a thorough discussion with your doctor. The doctor will weigh the pros and cons based on your specific situation and indications to choose the most suitable method for you. We hope every snorer and their sleep partner can find freedom from the troubles of sleep apnea. All right, that's all we have for today. But are there any other diseases you'd like to learn about? Feel free to leave a message in the bullet comments or the comment section. We'll pick from them the topics that you're interested in. See you in the next video.